So, here's the real question. How do dentists like you, who aren't willing to let insurance dictate how you will run your practice, who want to create incredibly profitable practices without sacrificing your time or sanity, how do you create the strategies to ensure your practice not only survives, but thrives in the 21st century? That's the blaring question, and Dr. Steve Schlintz is here to provide the answers. Welcome to Dental Practice Freedom Radio.
Hello, welcome back. This is Dr. Steve Schlintz, and it's going to be another exciting episode of Dental Practice Freedom Radio. And I actually batch recorded these last 4 episodes because I was in such a groove, and now I'm kind of feeling it because I feel like I've been recording for about an hour and a half, and I'm thinking, wow, this is a lot of information, and I want to make sure that I'm not forgetting anything. So in this episode, if you're listening to this, like I said, now you got to go back 3 episodes. To start at the very beginning, where we're talking about the new patient process. And this is the last episode in this 4-part series. And what we're going to talk about today is the initial review of findings. You can call this an information and possibilities appointment. You can call it rounding up the troops and telling them where everything's at. This part is often a part that is overlooked. And dentists really, really struggle with this. I know even in the training I got, we spent a lot of time on the interview and a lot of time on the exam. But when it actually came to the review of findings part, this is where dentists struggled. They really, really struggled. And so what I tell you in the next 10 to 15 minutes is going to be a really good foundation, but you have to understand there's an art and science to this. So I'm going to try to tell you what I know, but also not completely overwhelm you, okay? So when you bring a patient back, it's very important to reestablish where you're at and why you did what you did. Okay, so you want to talk about the previous steps. So the first thing I do is review the goals that the patient had set at the initial interview. Okay, they might have been very simple, like I just want to control decay or I want to start to get established again. You want to bring those goals back up and get them into the head of the patient. Okay. The second thing you want to do is actually start to review those healthy slides that we looked at in the interview. You're starting to prime the person again to remember what health looks like. Okay, and there's a very specific reason for that. It's the next part of this interview process or the review of findings process. We're going to look at these healthy pictures, and then side by side on a computer screen, we're going to look at what their pictures look like, what their teeth look like, what their gums look like in comparison to health. Okay, so when you're doing that, by reviewing health first, it's going to give them that picture, and then they're going to be able to compare and contrast. And so when I get done reviewing health, I said, no, what we're going to do in this review is literally I have no treatment plan for you because I have no idea what you want or what you want to accomplish right now. We're only going to be able to establish some type of plan after we go through these pictures together, and you really tell me what it is you're looking for and what you want to achieve. And then we're going to create a plan together to help you do that. I don't try to make judgments for you as to what I think you should do. I want you to tell me what you want to do, and then we can work on a plan together. Again, this is all about establishing bond and rapport. So tell them, I don't have a treatment plan for you. I have some recommendations. I have some things I'm going to point out to you, but you don't have to follow any of what it is I'm doing as long as it's not going to kill you, right? Like I will step in if I know it's seriously detrimental to your health. But everything else is pretty elective in dentistry, and I tell patients that, right? I want to give them the freedom to be able to choose what it is they want to go with. So once I do that, then I bring up the pictures of health and the pictures of where they're currently at. And here's the question that I ask them. What do you see when you look at these pictures? What I'm trying to do there is judge the level of engagement. If they have severely worn teeth and they're looking at unworn teeth and they're trying to compare and contrast and they say, oh, it looks about the same. It's just like at the exam process, if they're not involved in that dental fitness program, I know they're probably not an engaged patient. But if they have some level of engagement, they might be asking, well, I kind of see this here, and I don't really know what that means, but I'm looking at this, and I'm looking at this. I know they're engaged in the process. And then I can start to point out some of the things that concern me. And so you want to go over what healthy pictures look like and their pictures. You want to be able to compare and contrast. Sometimes I'll even throw up disease pictures, so they got health on the left and disease on the right, and they're in the middle, and I say, does it look more like health or does it look more like disease? And that is also very, very effective, okay? Once I get done with those slides, then I move on to the assessment, the dental fitness program assessment. Remember the plaque and bleeding score any obvious decay, any pockets. I said, these are kind of like the baseline things here. If you have decay and you have pockets, like we have to take care of those, right? Another thing that I do is I actually have an assessment pyramid. And so at the very bottom of the pyramid is periodontal health. And so I talk about this with the patient. There's so much like stuff. I can't really explain this over a podcast episode, but it gives you an idea. If anybody is familiar with the COIS model of risk assessments, I use something very similar to that, but I put it into a pyramid formula and a format so that they know, are they really, really at risk here of losing teeth because of gum disease, or are they not at risk of losing teeth due to gum disease because of where they're at in the pyramid, right? And then I just keep working it up. So I got periodontal disease, and then the next step of the pyramid is tooth decay, and teeth that are at risk of having breakage. And then I go up, and it's, jaw joint health and bite stabilization, like how unhealthy is their bite. And then the next step is, long-term therapy for their teeth. And then the next step is overall health, like general health. And I don't get into that realm, but I mean, if patients really want to start to look for alternative types of care, I do have referral sources that I send them to. So I go up that ladder with them, and then they get to stop wherever they want to stop. Okay. So I have that assessment. I now have where are they at on each end of the pyramid. And then I have a very simple slide. So I have a slide. It's got a road that is completely paved and perfect, and I got one that's all broken down. And I say, traditional dentistry, if you remember, I know I'm talking fast, but if you remember, we kind of talked about like when you continue to treat disease, you just never really get any healthier. You just get more disease. That's kind of like this road here with all the potholes that have been patched in. Sooner or later, you're still not going to be able to drive on that road. But the problem is by patching, and then not driving, you're wasting a lot of money patching something that's never going to work. You also have another option, and that option is basically laying down a solid foundation and having a new road built if this patient is well down the path of disease. And depending on where they're at, they get a choice. They can continue to patch, they can continue to do traditional dentistry, or they can start to look at a new way of doing things. And I want them to answer me, like, what do you want? Do you want to continue to patch, or do you want to build a new road? Like, you get to choose, and I'm not going to judge you if you choose to patch or you choose to create a new road. I just need you to know you actually have a choice, okay? And so whatever they tell me at that point is going to drive my conversation. So this is all in PowerPoint slides, but I talk to them. This is the benefits of doing traditional dentistry. This is the downside of doing traditional dentistry. This is the benefits of doing building a new road and doing what I call biorejuvenation dentistry. And it doesn't even have to be like the composite rehabilitation. It's just the way of approaching health from a prevention standpoint. And so once they tell me, I say, okay, so here's the pros of doing it with biorejuvenation dentistry, the cons, okay? And once I do that, they're going to tell me what they want to do. And again, I tell them, I don't have a treatment plan for you. I'm not going to give you a sheet of paper that has 3 MODLF, and I'm going to say it's a filling and it's this amount, this amount, this amount. I start to break everything into sections. And if they say, I want to go down this path, this road of creating a new road, I say, okay, wonderful. Like, we're going to have to create something that I call a master plan. And I learned that through the Schuster Center, and I started to modify it and make it, my own. And I really elaborated on that, and way beyond the scope of this podcast. But basically, it's a long-term plan for a patient that we create together that is broken into stages. Gum health first, gum and bone health first, then getting decay under control, then wearing an appliance to stabilize your bite, and then long-term therapy with composite to be able to balance everything so that this patient can go a long, long time with very minimal issues. And it's all on the sheet that they can follow along with. Now, if they say, I want to get started, I'd start to look at, like, what are the immediate things they need? Do they need some type of treatment for periodontal disease? Do they need some restorations to remove decay? I want to have some plan in place so they can get started. But I tell them it's going to take some time to create this master plan together. And so over the next couple of visits when you're in, we're really going to be talking about some of these things. And I'm going to have a plan for you that lays out every step in the process. And that way, as you're going through, you can literally check these steps off, and you can check off the day that you've done them so you know where you're at in the whole process. I know that's elaborate. I know it takes work. Some people have, and I also have a sheet that basically, when I go through this review of findings, they have a 2 or 3 page sheet with each rung of the pyramid and a breakdown in that rung where they currently are at, and I give that to them. And the reason I give that to them is it describes everything that I'm talking about, and I also give them a copy of my PowerPoint that I made for them, so they know at all points in time what I was talking about. And so they're never confused. If they go back to their spouse and like, well, he talked about a lot of stuff and I don't really remember what it was, it's very confusing. But if I give them a folder with my review of findings and then also the PowerPoint copy, they know what I was talking about on some level. And I have found that taking this approach is by far the most beneficial approach I've ever taken. And, the reality is sometimes at the end of the initial review of findings, they might need additional records. They might need more jaw joint analysis. They might need diagnostic models worked up. They might need a FACEBO, right? They might need all of these things, and those can happen at subsequent appointments. But what I have seen happen too often is dentists try to collapse all of this stuff into a very short period of time, and they completely overwhelm the patient. If you remember, I talked about a book called Spin Selling, and basically you want to draw this process out so the patient can start to have their own epiphanies and they come to their own conclusions on what this all means to them. And so you have to walk through this process slowly. And if you do it correctly, patients buy into what it is you're trying to do for them so much more than if you just jam it down their throat and you give them a 10-page treatment plan and say, okay, Betty Sue's going to come in and she's going to talk about financial arrangements. That game doesn't work. It just doesn't work. So you want to involve the patient. You want to give the patient choices. And sometimes they say no, and you have to learn to live with that. But if you set this up correctly, and I've seen offices that set this up correctly, it is a game changer. And if you're doing high-end technical dentistry at any level, you need to master this process. You need to go back through all the books I talked to you about at the very first podcast episode, really study the masters, study people outside of dentistry that understand sales, right? Zig Ziglar is a great one. Right? All of the sales masters, you can take all of that information and start to put it into your new patient process. And I know every time I say the word sales, I know a couple of you probably wig out and you go, I'm in dentistry, I'm not in sales. And why are you talking about sales? I don't like sales. Those people probably aren't even on this, because if they listened the first few and I said sales about 4 or 5 times, they probably have left. They're gone someplace listening to another podcast, and that's okay. But for you, if you're listening, fall in love with the idea of sales as something you do for someone, not something you do to someone. And then start to implement all of these things one thing at a time. If you ever have questions about this, this is my baby. This is what I talk about. This is what Dental Sales Secrets is all about in my program. This process is everything, right? And so there's stuff that I haven't been able to get into just because of the nature of a podcast and trying to explain it. But you have to understand that. You have to start to put this process in place if you want to do more comprehensive dentistry. That's just my opinion. I know people that can do it without it, but time and time again, the most reliable strategy is what I just outlined in the last 3 episodes. So hopefully that was a lot. I mean, it was a lot to even talk about, and I'm sure I'll be doing podcast episodes in the future to elaborate on some of these concepts. But I wanted to get that out there because I've been waiting and say, I need to talk about these things because it's so important. I get so many questions about this, and I've done this process over and over and over again, and I've never done a comprehensive case without doing this, ever. And people really buy in, and they're tied to you. They really understand you. They trust you because you've went through a process with them that establishes trust. And that is everything when you're doing comprehensive dentistry. Because here's a news flash. When you do comprehensive cases, it almost always will go wrong at some point during the process. And so that trust that you built up with that patient is everything. So hopefully I built some trust up with you so you understand the value of what it is I was telling you in the last 4 episodes. And if you got value out of this, please leave a comment or a review on Dental Practice Freedom Radio through iTunes, or go to Dental Practice Freedom Radio, grab your free master pack, and as you're going through that process, there's always opportunities to tune into the webinar. So I don't want to bombard you with information, but I really do think this is important. This is the piece that most dentists miss, and I feel it's most critical. So hope you guys have a great day. And I have no idea what I'm going to talk about in the next podcast episodes. I'm probably going to take a few days off from recording podcast episodes, but hopefully you have a great April, and I'll talk to you soon.
Thank you so much for listening to this episode on Dental Practice Freedom Radio with Dr. Steve Schlintz. We'll see you on the next episode.